Hi guys, Pharmacist Geek here. So today's video we're going to be looking at antidepressants. As healthcare professionals, we all know that there are myths to do with pretty much everything in healthcare. We're going to delve into the common myths with antidepressants. These are gathered through sort of my friends who are pharmacists, mental health specialists, myself obviously doing research in my practice as well. So let's dive straight into it. The first one is that once someone is started on an antidepressant, they have to continue it forever. So let's delve into that a little bit. So first of all, no, when you start an antidepressant, it doesn't have to be continued forever. Typically what we say is that you continue it for 6 months after symptoms have resolved. If it's recurrent depression, then typically we even increase that to 2 years. And this is to stop relapse, stop the patient from going back into sort of a depressive state. So no, it does not need to be continued indefinitely. And then the second one is it safe to stop antidepressants just as soon as you feel better? Should you just stop it? And the answer to that is typically no, especially with SSRIs, but it's very similar for most antidepressants. You will have sort of symptoms from withdrawing the medication abruptly. It could be sort of flu-like symptoms, stomachache, general feeling unwell, sleeplessness. So usually always recommend patients not to stop it abruptly. If they're thinking about discontinuing it, they need to have a discussion with a healthcare professional. It varies for different medications, but for antidepressants, it'll be tapered down. Next myth is antidepressants are addictive. This is a very quick answer. It's just a straight up no, they are not addictive. I'm going to move swiftly on because there's not too much to talk about on that one. The next one is antidepressants are effective as soon as they are taken. And this is also a myth. There has been research which has shown that positive results can be seen within a week, but they're definitely not sort of instant cures. So we need to make sure that we're counseling patients on that and making sure they're aware of the correct information. The next myth is that all antidepressants cause weight gain. This is also incorrect. Not all antidepressants cause weight gain. Some patients also experience weight loss with antidepressants. With SSRIs in particular, you can have weight gain or weight loss. And it's not just a blanket that all antidepressants will cause weight gain. Even the ones which are more likely to cause weight gain doesn't mean that the patient will definitely increase in weight. For some patients, this will be a big factor for deciding not to start treatment. There are medications such as mirtazapine, which are much more likely to cause weight gain, and it's important to be aware of that. This one's specifically for SSRIs, and the myth is that SSRIs can be taken at any time during the day, especially at night. And that is a myth. See, because SSRIs can cause insomnia, it shouldn't be taken at night. It's best to take it in the morning. There are a lot of cases where patients are started on sleeping aids like zopiclone, when perhaps switching the SSRI from nighttime to the morning may have benefited that patient. So it is a nice one to know. Alright guys, that's all my common myths about antidepressants. So I'll see you in the next video. Like and subscribe, share it around, you know what I'm saying. Alright, I'll see you in the next video. Peace.